So I sustained a concussion just 2 days after optometry's meeting last year, where I actually did a lecture on concussion. Right. So we've been seeing these patients for years, and I felt like for the most part I understood what a concussion was like. And then having one myself, I realized that there was so much that I didn't understand. And I had accommodative issues, I had convergence issues. I was thrown into a multifocal lens situation because I couldn't focus. And it was a couple days out that I said, wow, I need to do right eye. Because I did have a baseline that I'd done about a year previously that was quite good. My scores were great. And I did right eye for the first time a couple days after the injury, and I was blown away, because of course I feel all of these symptoms that are your textbook feelings that are hard to describe, just that sense of, unease. And of course I had some of the other doctors look at me, and some of the things are easy to see. Convergence issues are easy to see. Accommodative issues are easy to test for. But just looking at my pursuits, you couldn't see the downbeat nystagmus that I had. You couldn't see how horribly the synchronization between the two eyes were. And, that was really an eye-opener for me to actually get to see those results myself. The other thing that I found really neat about having right eye, because of course once I figured that out that I need to be doing this, I did it pretty consistently every few days. And as patients with concussions, explain, you have your good times and your bad times. At the beginning of a day, I might have a lot higher score. I come into work, I'm feeling good, I do right eye, I look great, my results are pretty good. And then I have a super stressful day at work. I lose my scribe, because she has to go do therapy, and I'm on my own, and I'm just super stressed. And then at the end of the day, I tank my right eye test. So it was neat for me to see the link with what you're feeling cognitively, and then what you can actually demonstrate on a score when you do the brain health IQ.
That's really interesting.